Today is lockdown for our country as we face the national responses to coronavirus pandemic. Earlier this afternoon, President Hage Geingob announced the guidelines for the 21 days lockdown in the Khomas and Orongo region. It is just about 5 hours before the lockdown this evening. Good evening, Namibia and the world. I am Patrick Sam, and our sign language interpreter tonight is Salma Moses. Joining me in the studio is obviously the Minister of Health, Mr. Kalumbi Shangula, as well as the Commissioner, that is Commissioner Joseph Shikongo, in the studio. Good evening, gentlemen. Welcome to the special broadcast here at the National Broadcaster.
Good evening.
Thank you. Good evening.
Honourable Minister, we've made it a custom now to start with you to give us the latest update, which is obviously intended to also lessen the communication gap, but to give us real-time information that is authenticated. So please give us our daily update in terms of where are we in terms of containing the spread of coronavirus.
Yes, the status as it was of yesterday remains, and if I can just recap what we announced yesterday, we have in the country currently 8 confirmed cases. Then we have 2 suspected cases in the area of Keetmanshoop, and we are waiting for the results to come out anytime, either tonight or tomorrow.
Okay. Given that there's any change in terms of quarantine and anything else, we know that there's 3 levels. We're talking about the screenings, the testing. Let's just touch on those issues again.
Yes, as we know that we have said that non-Namibians, they are no longer welcome to Namibia. Namibian citizens and permanent residents, they are welcome to Namibia, but they will have to be quarantined for a period of 14 days. Currently, we have identified different quarantine places, and we are making use of the existing accommodation establishment. We had the first group, which we hosted at the Greatest Conference Center. However, because of some problems there, logistic problems there, especially related to water supply, we have moved them to other locations. So today we are expected to receive another group in the evening from Europe, and they also being quarantined, and all of them, they are just Namibians who are returning back to their country.
Okay. Obviously, Commissioner, you here as well, we know there's a state of emergency that applies to the entire country, but let's talk particularly about the details of the lockdown. There was formerly some confusion of when it starts. Can you please clarify for us when it starts and when it ends, and what are some of the key details that the public needs to be aware of when it comes to this lockdown?
Yes, thank you very much. Good evening, Namibians. The Honourable Minister have indicated, in fact, the status of our country currently, and obviously the lockdown is starting tonight. That's on the 27th. That's 23:59, exactly 1 minute past midnight. That's when the lockdown starts. And that's now, obviously, we are talking about the borders of the Republic of Namibia. As the Honourable Minister said, no Namibians will not enter Namibia for no whatever reason. So the other issue that I should indicate that from the police, we are ready. And currently the regions that we are more focusing are the 2 regions. As of now, that's Khomas and the Orongo. And we have identified areas of lockdown for people coming for Khomas. We have got a spot 25 kilometer, that's south of Riobot. And then we have got other 2 points, that is one on Okahanja or Chuarongo Road, and the other one Okahanja Karibib. And then we have one as you are enter Karibib, we have one that's cutting off people that are moving from the north or from anywhere going to Wolsby and Swakopmund. And then we have got one that's on the Hobabis Windhoek Road, that's CS police, near CS police station. Basically, we are ready. Our deployment have already started, and as comes the midnight, we are ready, and will not allow any person to enter those areas or those checkpoints.
So to be clear, are we saying that there's no travel into these two regions and outside of these regions, Honorable Minister?
Yes. Commerce region is cordoned off. Nobody goes out, nobody comes in, except in case of emergencies.
Okay.
Yes.
Let's talk about the exceptions. Who is exempted rather, in this instance from moving in and out? Commissioner?
Well, we have a long list of people that are, or entities that are exempted from such service. We are talking about essential services. And we are also talking about critical economic services. For instance, like supply of food, supply of fuel. A tanker that's coming to commerce and bringing food or bringing fuel, obviously this will be allowed. Because as much as we are implementing this, we will make sure that the fundamental human living should not be disrupted, such as food provisions, medical services, medical personnel should be moving. And I think if you go to the regulations or to the stipulated, I think if you refer to that document, it's clearly indicating which areas are allowed to travel in those checkpoints. And our officers are under instructions that those services that are defined, it must be very clear that they should allow them. Where they have doubt, they must communicate to the authority so that we give them clear directions.
Is there any certification, we know at the NBC that they're giving you letters from your employer. Is there anything that validates that you need to show to the police forces to say, I'm exempted or I'm from this industry? Are you looking for particular proof?
This is in fact what we are encouraging. Like for instance, even the members of the security agencies, for instance, if they are traveling out, we are encouraging them to get what we call the route form from the employer. Mm-hmm. And we're also encouraging other institutions, if somebody is working for a security company, should carry out something that is indicating that yes, this person is indeed from security company, or if it's somebody's medical services, somebody should really indicate that yes, I'm a doctor, I'm going to attend to medical services. Okay. So I think those are the things that we require, just to have a proof that yes, indeed. But then will have a situation, for instance, like situation of funeral. Like just before we came here, I was indeed conducted by a family. That family, there was an accident last night, and that accident claimed about 5 lives of one family. And then now the body are here to go through the post-mortem. And obviously once they complete, this family will come to the authority and ask for permission to travel to go and bury the beloved one. We can't really come up and say, no, because of this, we will not allow you to travel to bury the beloved one. I think those are the exceptions that we are referring to when we are talking about the exceptional situations.
But there's also this gray area that people want to actually find out about. For instance, going to the shop and getting what your daily needs are. How do we mitigate that type of example? If I, for instance, find the police on my way to the shop, that's what I'm going to do. How do we deal with those kind of softer areas, Commissioner?
Well, that will be very difficult, very, very difficult. And I think what we did, because really what we are trying to do, we really don't want to come up and say nobody will be moving. Because at this point in time, the authority and the private sectors are encouraging people to work from home. But there are people that are going to perform such essential services, and they will be required to go to their workplaces. Obviously, we are going to allow them. There are people who are working in supermarkets or food markets. We are going to allow them to go to work. But then you will have families or individuals that have no food at home and they want to go to the shop. It will be difficult for you, somebody to prove that indeed I'm going to the shop. That will be very difficult. I think the officers will also make it their own discretion to allow this individually to access the groceries. That's one of the issue. But what critical that came out from the guidelines or from the decision made by the authority is really indeed, yes, from tomorrow, we are closing it down completely the liquor outlets. No liquor outlets in the Republic of Namibia will be operating, including shop-ins, bars, clubs. They are completely shut down. No alcohol will be sold as from this midnight.
And there was also an assertion that there could be alcohol and tobacco, or is it just alcohol that will be restricted? Is it tobacco as well? Because there were some rumors on social media that it's also alcohol and tobacco. Is that the clarification?
Well, that one I hope I will.
Honourable Minister?
Yeah, mostly the alcohol outlet is also where they sell tobacco. Now, if the alcohol outlet they are closed, so obviously nobody can access the tobacco. So, well, although this has not been expressly, stated, it is also implied.
Okay, so let's talk also about the other limit prohibition, which is in motor vehicles. Certain people are limited. What are the exact criteria or expectations when people are traveling in cars?
We have made clear stipulation, and the whole issue is social distancing, so that you do not have people cramped together, because that way then you will have the transmission taking place. Therefore, it has been stipulated that in a vehicle, maybe which has got a capacity to carry 4 people, there should not be 4 people in that vehicle at any time when it's moving. It must be 3. And if it is a 7-seater, not more than 4 people should be in the vehicle. And if it's a bus, if the bus has got a capacity of 60 seats, then only 30 should be traveling in there. Half of that should be allowed to travel in that vehicle. And the main purpose really is to minimize close contact, what we call now social distancing, because the transmission will only take place in close proximity. That is within a distance of about 1 meter.
You're talking a little bit about maybe explaining the connection between why alcohol prohibition is not being allowed in such a time of a pandemic from the health perspective. What's the connection there?
Yes, the connection is here that, when a person drinks alcohol, the sense of judgment becomes blurred. And then during that process, a person can be exposed to the risks, and unknowingly or knowingly, because now start in what's uncontrolled behavior, because your sound judgment has now been blurred. And that's exactly from that particular point of view that you are no longer having your clear faculty in order. And that's why, in order to prevent people falling into that situation, the alcohol has been banned.
Okay. I think what some of the concerns, Commissioner, also is, obviously crime is not going to stop because COVID-19 is around. What are you taking in terms of precautionary measures for certain people that might be taken into custody during this time? Are also some of the concerns are the forces themselves have protective gear when they're engaging the public? Sometimes you might have to use force to engage that. So how does that encounter look like now for the forces in being also protected in their interest? I mean, we've seen in places like Spain, health practitioners, the people on the front line, might also fall victim to the spread of the COVID-19. So how have you taken care of your officers, ensuring that they are protected, one, but also the way that they engage includes things like social distancing, the things that are being advocated for? How are you getting that tricky formula almost right?
Yes, what you're trying to do in the first place, I think, is the law enforcers. We are trying by all possible means to ensure that the officers are also protected. But remember that when you are in forefront, there are always risks involved, but we are trying to minimize the risk. So in the first place, what we are going to do, like most of our officers when they are going to work, they are in combis, they are traveling in quantums. So we are trying also to reduce their number in one vehicle. Obviously, that will also apply in our situation. Then we are talking about in contact with the public. So our members are cautioned that when you are arresting a person, obviously those situations, those measures will also come into play. So we'll make sure that we give them the protective, the gloves, the mask, and the sanitizer. We have already started doing that at most of our area, including those who are going on an arresting mission. Obviously, you will find people that are drunk. Some people might, like today, they might be buying stocks and they keep them in their house, start drinking, and then they go and do funny things. But the law enforcement will not tie their hands. Obviously, we are going to go out. Like last night, I got a call around between 3 and 2 that there was somebody who came home very, very drunk. And then another situation again, our officers last night, they went out to a bar in that attempt of convincing people to disperse. One student from one of the institutions just picked up a bottle of throw-it to one of our officers who was injured, badly injured at the lips. So those are some of the situations. So we are trying to really to do the best we could just to ensure that during this process, we are trying to make sure that we engage the community in a very professional manner. But we are also appealing to our community to cooperate with the law enforcement and to adhere whenever they are giving instruction. We are not there to punish them. We are not there to, we know this is something that nobody actually predicted. We find ourselves in a situation. Therefore, we are appealing to Namibians. Because it looks like if there are no measures such as this one that are taken now, Namibians will not adhere to that. I've seen for the past couple of days, despite the report of cases that we registered in Namibia, if you drive around town, around Windhoek, you could still see people in big numbers. I think the first number was 50, it was reduced to 10, but if you go even now, as we are talking to you now, if you go out, you will find a big number of people still in bars. And some of the shabins are very small in size. You really can't even accommodate 5 people. But you will find about 15, 10, 20 people. And these are drunkard people. And the drunkard people, as the Honorable Minister indicated, that when you are drunk, you lose your sense of responsibility. You start touching people, you start hugging people, you forget that there's even measures that we should not shake hands. These are the things that are happening, practically happening on a daily basis. So therefore, these are the issues that we are trying to avoid. In terms of arresting people to the cells, this is one of the challenges. Because like most of our cells are very overcrowded. But I think that has been discussed at the highest level, and we are trying by possible means to see how can we reduce the number of inmates. Perhaps one way of doing that is to look at those who have got minor cases, so that maybe we can give them someone to appear before the court. And those who have been granted bail at the court, maybe we can also engage the prosecution just to see what we can do so that these that are given bail are also released to go home.
Okay. Honourable Minister, obviously in terms of you talking about a national response, what are some of the gaps that exist in the current response?
Yeah, I do not really think that there are major issues which would hinder the effective response. However, there are some of the issues which I can clearly state that it appears either we do not communicate effectively to the public, or the public is not listening, or the public is not following what we are talking. One of the 3 issues. Because still the level of awareness of the substance is not there. What you find is panic. Irrational panic, I can say. And that is a result of ignorance. Now, one ask oneself, is it because maybe our messages are not clear, or they are not effectively being communicated, or why are the people still not knowing the basic facts? You repeat the same thing today, the next day a person will ask the same question. So that is an area of concern to us, that the public does not really grasp the substance of COVID-19 in order for them to be able to see how they can protect themselves. Instead, there is just a fear of something maybe which is somewhere there coming to engulf everybody. So that one for me is a really an issue of great concern. Maybe we still need to go to the drawing board to see how we can tailor our messages to the public in such a way that they are simpler and maybe easily to understand. But we also want to ask the public to listen what's being explained and internalize that. That is one thing. The second thing which I can mention is that we do not have the sufficient human resource. We do who are properly trained. We do have people, and I must say that we are very, very much pleased because a lot of people are coming forward to offer their services on a voluntary basis. But of course, they also need to be empowered. They need to be empowered to understand that, and it's really basic. You have a disease. If I have a COVID-19, how does it transmit from me to the next person? Then, if you understand that basic fact, you will know that that is a chain of transmission. And in order to disrupt that, you have to break the chain. Once you break the chain, then transmission will not take place. That is the basic thing which everybody needs to understand, and there should not be any fear, there should not be any panic, but really to capitalize on that information.
But I have a follow-up question in terms of that, because we have, had not a pandemic, but an epidemic in terms of HIV, and we had to change almost the ground strategy from things like introducing home-based care, where civil society and almost the Global Fund model with the establishment of the Nakatums and things like that became essential in bringing stakeholders together. They can then also ensure the extension and sharing the responsibility of that. So my question then becomes, are we being strategic in possibly having the COVID-19 curriculum in terms of a response in terms of prevention and treatment be extended onto such health workers to say, we have people that have been trained in pro-health approaches, anti-HIV. How do we use existing malaria interventions, tuberculosis, those health practitioners that have done almost this ground level, bottom-up kind of approaches to deal with the seriousness of COVID and not just relying on traditional media or social media to get that message across, because it didn't work when we were trying to teach communities to an extent about HIV. So are we looking at things like that as well, Honorable Minister?
Yes. In fact, I recall when HIV started, there was also that particular fear, stigma, discrimination. Nobody wants to be associated with somebody who is said to have contracted HIV. So that was a problem then. But again, then we employ to a large extent social marketing strategy. And it did work, and with time, the stigma and discrimination dissipated. Now, in the case of HIV, it was possible to gather many people together and talk to them, which is you can no longer use the same strategy in the case of COVID, because in the case of COVID, you are trying to minimize the number of people. So one has to employ a different strategy, not the one we are using in terms of HIV/AIDS, because you cannot gather people together and explain to them and tell them. You cannot do this focus group discussions, which we really utilize during the HIV. So we have to go to a different mode altogether. And the effective one could be the ICT. But then also, not everybody is conversant or having the necessary gadget to communicate effectively. So there is this type of challenge which we are facing.
Okay. Obviously, Commissioner, there are some fines if we don't adhere to the regulations that were brought out this afternoon. Can you tell us some of the implications? And obviously, before we answer that question, we're taking in callers now. The number is on your screen. That is 061-291-3339. Please do call us in and give us your input today. Yes, Commissioner?
Yes, there are some fines that are provided by our legal experts, and obviously I can come up with one very clearly indicated that if you violate the lockdown principles or measures, you will be given a spot fine of 5,000 or be arrested right away.
Okay. Well, maybe you heard that is a $5,000 Namibian spot fine, or you will then obviously be taken into custody as well. Let's look at some of the other issues in terms of, obviously we're taking in callers. Please do call in. We have a caller. We lost the caller. Honorable Minister, let's look at essential services. And again, what we're talking about, the example yesterday of almost like a comprehensive national response, so that the burden is not solely on the public sector, and then that gets strained. But how do you now, obviously, days into it, who are your key partners to ensure that the containment of the spread is achieved?
Yeah, our principle is that this challenge is everybody's challenge. And the government, partners, stakeholders, they must come together. We have been able to mobilize quite a number of stakeholders. They are on board. When you look at our National Health Emergency Management Committee, it is multi-sectoral in nature, and it's also multi-skilled. You have members from different backgrounds, and in that way you enhance synergy in such a way that the outcome will be at a more higher level than we go it alone. Both the public, the parastatal, and the private sector, we have joined hands. During the last press conference, which was hosted by His Excellency the President, he announced the establishment of a special fund to which members of the public can contribute. That contribution could be used again to fight COVID-19. And there has already been a good response from the public.
Okay. Sorry, we have a caller. Dina from Windhoek, good evening.
Hi, good evening, sir. How are you this evening?
We are well. How are you? Please give us your contribution.
Yes, thank you very much. I'm going to be very short. These 8 cases that have been reported, as I've been following the press and so on, I remember the first 3, it was like people from outside Namibia visiting Namibia. And my concern was, or my curiosity is lying on the other cases. Is it local Namibians that have been diagnosed with the virus, or is it still people from outside Namibia that travel to Namibia?
Thank you very much for that question, Dina.
Thank you.
Honourable Minister.
Yes, thank you very much for the question. I can give you a breakdown of the cases we have so far. The first 2 cases, that's case number 1, number 2, they are foreign nationals who came to visit Namibia, and while in the country, they were diagnosed with COVID-19. The same applied to case number 3. It's also a foreign national who have been in Namibia for some considerable time. We are talking in terms of not days, but a couple of weeks. And they're also coming in and going out, etc., etc. So that was also unimported. So the first 3, they were all imported. Then we have case number 4. This is a Namibian who has been outside the country, and immediately he arrived here. He developed symptoms, and then he was confirmed as COVID-19. So that was the first recorded case involving a Namibian citizen. And then another case number 5 also involved a Namibian citizen, and this case was also the transmission also occurred outside the country. Number 6, case number 6, it's also a transmission that occur outside Namibia, but it involves a Namibian citizen. Now, case number 7, this is a case involving a foreign national who came to Namibia and then was also recorded as COVID-19 positive. And then the last case, case number 8, it involves a contact of case number 3. So those are the cases which we have in Namibia. So there is, in the case of case number 8, that can be considered as a local transmission because the contact happens inside Namibia.
Okay. Well, Namibia, there you have the update of all your 8 cases. We'll take a quick break, but when we come back, we'll obviously look at what is the missing detail of this lockdown, just to make sure that you're informed here on NBC One. Stay with us as we bring you the special broadcast from our studios here in the capital city. We have 30 seconds. How much time do we have? How much time do I have? This is COVID-19 Update Namibia, where we are giving you the latest information for this global pandemic that has taken the world, and Namibia obviously has its response. We've been joined in the studio by the Honourable Minister of Health, Dr. Shangula, as well as the Commissioner Shikongo. I think maybe, Commissioner Shikongo, you can clarify particularly the issues around the lockdown and how Rehoboth and Okahania, the 2 regions that kind of fall on the borders, are also then going to, be affected by this, the roadblocks in terms of that.
Yes, thank you very much. When it comes to the policing, in fact, Rehoboth is under halt up, and Okanja is under Ochozonjupa. But now taking the dynamic of the two towns, when you look at the number of people that are working in Windhoek or that they've got houses in Okanja and they come to Rehoboth, we realized that no, these two towns should be part of the commerce lockdown. So therefore the near town like Kakrant and Marintal, talking about Karibib, talking about the Chuarongo, obviously they can be affected by that. Therefore, the two roadblocks or the roadblock that we put outside, actually 3 of them, one in south of Rehoboth and the 2 north of Kanja. In fact, they are even, when it comes to police functions, they are manned by HALTAP. The regional commander of HALTAP region is under instruction to man that. And then the Okahanja is manned by Ochezonjupa, while the other one in Karibib is manned by Erongo. We have also some other small roads that are coming like Ovitoto. We have the Cap Farms. We have the one that's Commerce Auckland, and so on. All those roads can lead you to somewhere, but of course we have made also some precautionary measures to make sure that they are also manned by police officers. Where we have 2 police officers, normally we are trying to redouble our staffing them, just to ensure that we have got effective control in those checkpoints.
We have Michael from Walfish Bay that's on the line. Good evening, Michael. Good evening, Michael.
Yes, good evening.
Can you ask us your question?
Yes. Good evening, Sam.
Good evening.
I just have a question to the commissioner there.
Please go ahead.
So my question is straightforward. Yeah, since this lockdown is now directed only for Commerce region, which were added Rehoboth, which indeed falls on Hadap region, and then also Okahanja, which is part of the Jupa region. So if we go back to Erongo region, Erongo region goes as far as Yusakos Karibib, maybe part of Omaruru. We go down, we go up to Hendisbai. So my question to the commissioner is, those people who are going to violate the terms and conditions of the lockdown, those who might be arrested by the armed forces, is the government prepared? Is the government having facilities where we can keep these people? I thank you.
Thank you.
Yes, you know, the intention of lockdown really, and the deployment of the police officers or the law enforcement officers is not there to go and arrest people. So first of all, we are appealing to Namibians to cooperate, because this is a national, not actually even a national, it's a world pandemic. So we are appealing to people to cooperate. It's not a question we don't want even to hear that somebody was arrested violating this lockdown. We want everybody to cooperate, because it is in the best interest of all of us. Whether you are a police officer, whether you are a soldier, whether you are a doctor, whether you are a pilot, whether you are a journalist, so we are all affected. It's just a question that we are appealing to Namibians to cooperate for the 21 days that we have got the lockdown. It's not about 6 months, we are talking about 21. However, we cannot predict what's going to happen after 21 days. We are talking about, we started with 1 case, and now we are talking about 8. So let's look to our neighbors of Africa. Started at that low number. As of today, we are talking about over 1,000. So it's a question of people to cooperate with law enforcement whenever they are. We are even going to appeal to them. Please say, Madam, may you please return back.
But I think the question still stands to, will somebody's health possibly be compromised if they're in the custody of the Namibian police? I think that's the question that people want to know, whether their health or somebody, if your child gets arrested for whatever reason. It might not just be for COVID-19 cases, it might be for housebreaking and whatever. But I think the general concern is whether people's health will be compromised under the protection or under the guarding of the Namibian police.
No, I don't think there's any health to be compromised, because we said when we talk of these checkpoints, it's not only the police that are there or the defense. We are also going to have staff from the Ministry of Health and Social Services, the medical practitioner. They are going to be deployed, the professionals, they are going to take care of issues relating to health of our people.
So another just a question that I was getting here is when are people, for instance, we talked about funerals earlier, is that a justified reason to travel between Khomas and Orongo? When are the exceptions there?
Yeah, when it comes to an issue of funeral, for example, according to the guideline, funerals are allowed. So that is considered as an essential part of our human existence, to show respect and to come to terms with the loss of a loved one. So funerals are allowed to.
So you're allowed to travel then in between, say, the two places?
Of course, if, say, for example, if it happens that you are in Khomas, which is on a lockdown, and then the funeral will have to take place outside the Khomas, then of course the necessary authorization and permission will have to be obtained, as Commissioner has alluded to earlier.
Okay. We have Bianca on the line. Bianca, good evening, welcome.
Good evening.
Can you please ask us your question?
Good evening. Hi. Yes, I wanted to find out, just a clarity I'm seeking. So with the lockdown, we've got some family members who are in hospital or in prison, for example. How will we go about visiting them? Should we provide proof or something?
Okay. Thank you, Honorable Minister. The nuances.
A lockdown means it means that you have to be in your home. Okay. You must have very, very good reason to be allowed to get out. Now, if it's a visit, the hospital also have put measures in place concerning visits. So there are also measures already which has been instituted by the hospitals, which will mean that even if you move from home, you may not be allowed to see the patient you went to visit.
And in terms of custody?
Well, it is because when we talk of custody, we are talking about people that aren't the inmate, what we call the trial awaiting inmates or prisoners. Then we are talking about that sentenced that with the correctional facilities. So as of now, for instance, like the one at, I think the measures that we put in place is that no visit to the inmates, because what we are trying to avoid conduct between people that are coming from outside and that are coming in.
Okay. Well, I think, Honourable Minister, one of the realities when we're talking about a lockdown, stay at home, is obviously certain people in informal areas in terms of access to water. What special provisions are made in people who live in more highly dense areas, but where there's also more of a shared culture around water, for instance?
Yes, the issue of water provision is quite a challenging one, and that has been acknowledged and recognized. So an appeal has been made to the municipality, and actually not on appeal, but an instruction has been given to the municipality that they should not close water. And where the water was closed, it must be reopened. So that's a directives which has been issued. And I'm happy to say that many municipalities has already headed to this call. In addition, it was also stated that there must be provision of water using water tanks to places where there are no piped water. And this has to be implemented. Because water is important, we say wash your hands. But if there is no water, you cannot wash your hands. And that's why, out of that consideration, these directives were issued.
But some of the reality is that there's prepayment to water systems. So there's the economy to this, similar that you've identified. So how do you then allow people that pay for their water before using it to access water points? Is it now through the alternative modes that you were speaking about?
Yeah, that could be maybe through water tanker, if the system cannot be changed to allow for the water to go through. I was listening the other day the case of Rondo Town Council with NAM Water, because that is also a system where you pay first before you use the water. Now, there has been negotiation between the Rondo Town Council and NAM Water to change that system so that it could be pay after use. But I don't know whether there has been really a resolution to that matter. But it's just interesting that already there has been attempts to bypass that constraint.
Obviously, we're ending towards the program. Commissioner Shigongo, what is your main message to everybody in the country, considering the state of emergency that we're first within and within the regulations of the lockdown, precisely the perception around policing and police officers themselves? What is your fundamental role in protecting the public interest with regards to COVID-19 and containing its spread?
Yes, primarily the law enforcement, the law enforcement officers, obviously will stick to their core functions, their mandates. That's to ensure that the crime prevention, crime detections, crime investigation. And then secondly is to ensure that at this point in time we dedicate much of our resources to the COVID-19 as a world pandemic, and obviously we are going to enforce those measures because those measures are meant to mitigate the further spread of pandemic to our people. I think more security, more safety, this is where we are going to focus for the next 21 days or more.
Thank you. Honourable Minister, in closing, I think, sometimes you might be perceiving these measures as punishment of some sort, and the state, the distance of its arm. But how is it important, again, to make the nation realize that these measures are in the interest of the people? Staying at home is to save, the possible unintended consequences or the implications of the pandemic. But ultimately, how do we allow the people to see that, these regulations are in my interest and they're here to protect me, my family and my community? Because we've seen the harm that it's done in places like Italy, where, early detection and early responses were not well articulated. So please talk to us about that aspect of how this is not punishment towards the nation.
Yeah. We have to choose between life and death. And in this case, we have chosen life. And in order to maintain life, unfortunately, it has come to the stage that some of our convenience, we will have to forgo them. We have to understand that it is easier to prevent than to treat. Easier to prevent. Now we are in a preventive stage. Let us make it as effective as possible. We can bear the current inconveniences associated with a lockdown for the next 21 days. It will not leave a permanent impact on our way of life, but it's a necessary inconvenience that we have to go through in order for us to maintain good public health and health for the Namibian citizens. Maybe before I conclude, I would also like to emphasize the fact that we are in a state of emergency. His Excellency the President declared on the 17th of March, declared a state of emergency. The state of emergency covers the whole country, the whole borders of Namibia. So the measures which are being instituted do not only apply to Khomas and Erongo, which is under lockdown. It applies to the whole country. And the President today noted that when the lockdown was announced, some of the Namibians decided to leave the two regions. Erongo and Windhoek. And unfortunately, during this rush, there has been fatal incidents, as alluded to by the commissioner. So what it will mean is that people coming from a high-risk regions like Erongo and Khomas getting into the other regions where the risk of exposure was minimal, then it means those other regions got exposed already. Okay. And then it might be necessary that the lockdown may be extended to those regions as well.
Thank you, gentlemen. Time is up. Namibia, there you have it. It is a state of emergency that applies to the entire country. The lockdown so far is obviously specific to the areas that have been mentioned. But remember, like the Honourable Minister said, that if you need any help, 911 is the number to call, or 0800 100 100 is the number for any emergencies. That's all the time we had. Until next time, have a good night.